Imagine a world where your own body betrays you. Where simple tasks like pouring a glass of water, signing your name, or even just walking across a room become an agonizing struggle. Your hands tremble uncontrollably, your movements slow to a crawl, and your voice grows faint. This isn't a scene from a dystopian novel, it's the daily reality for millions living with Parkinson's disease, a progressive neurological disorder that silently, yet relentlessly, erodes control over one's own body. It's a condition often misunderstood, frequently misdiagnosed, and profoundly impactful, not just on those afflicted, but on their families and caregivers. In this video, we embark on a comprehensive journey to demystify Parkinson's disease, exploring its enigmatic causes, recognizing its diverse array of symptoms, and understanding the evolving strategies for its management. Get ready to unravel the complexities of a disease that touches the very essence of human movement and cognition. Parkinson's disease is a long-term degenerative disorder of the central nervous system that primarily affects the motor system. Its origins can be traced back to a specific region deep within the brain called the substantia nigra, a cluster of dopamine-producing neurons. Dopamine acts as a crucial chemical messenger, facilitating smooth and coordinated muscle movements throughout the body. When these vital neurons begin to die off, dopamine levels plummet, leading to the characteristic motor symptoms that define the disease. This neuronal loss isn't sudden, it's a gradual, insidious process that can begin years before any noticeable symptoms emerge, making early detection a significant challenge. The exact trigger for this neuronal degeneration remains one of medicine's most pressing unanswered questions, fueling extensive research worldwide. While the exact cause of Parkinson's remains elusive, scientific research points to a complex interplay of genetic predispositions and environmental factors. It's rarely a single cause, but rather a perfect storm of influences that converge to trigger the disease process. For a small percentage of individuals, specific gene mutations have been directly linked to familial forms of Parkinson's, indicating a clear inherited component. However, the vast majority of cases are considered idiopathic, meaning they arise spontaneously without a clear genetic link. This is where environmental factors come into play, potentially acting as catalysts or accelerators for the disease in individuals who may already have a genetic susceptibility. Understanding this intricate dance between nature and nurture is key to unlocking the mysteries of Parkinson's. Several genes have been identified that significantly increase the risk of developing Parkinson's. Mutations in genes such as LRRK2, GBA, SNCA, and Parkin are among the most studied. For instance, LRRK2 mutations are considered the most common genetic cause of Parkinson's, accounting for approximately 5 to 10% of inherited cases. These genes typically play roles in cellular waste disposal, protein folding, or mitochondrial function. When these processes are disrupted by mutations, cells become vulnerable, particularly the dopamine-producing neurons in the substantia nigra. Studying these genetic links provides invaluable insights into the molecular mechanisms underlying the disease, opening avenues for targeted therapies that could potentially halt or even reverse neuronal damage. On the environmental front, research has consistently pointed towards certain exposures that may elevate Parkinson's risk. Pesticides, herbicides, and industrial chemicals, particularly those found in agricultural settings or specific manufacturing environments, have been implicated. For example, exposure to rotenone, a pesticide, and paraquat, a herbicide, has been linked to an increased risk in some epidemiological studies. Head trauma, particularly repeated concussions, has also been identified as a potential risk factor, echoing similar findings in other neurodegenerative conditions like CTE. While these links are not definitive proof of causation in every case, they highlight the importance of minimizing exposure to potentially harmful substances and prioritizing brain protection. The goal is to identify and mitigate these external triggers where possible. The hallmark of Parkinson's disease at a cellular level is the presence of Lewy bodies, abnormal clumps of a protein called alpha-synuclein that accumulate inside brain cells. While alpha-synuclein normally plays a role in synaptic function, when it misfolds and aggregates, it becomes toxic to neurons, particularly those dopamine-producing cells. These Lewy bodies are not just random cellular debris, they are believed to disrupt normal cellular processes, leading to cell dysfunction and ultimately cell death. The exact mechanisms by which alpha-synuclein misfolds and how Lewy bodies contribute to neuronal degeneration are still active areas of research, but they represent a critical target for developing treatments that could prevent or clear these harmful protein aggregates. The symptoms of Parkinson's disease are incredibly varied, earning it the moniker snowflake disease because no two patients experience it exactly alike. They are broadly categorized into motor, movement-related, and non-motor symptoms. The motor symptoms are often the most recognizable and are what typically lead to a diagnosis. These include the classic quartet: tremor, bradykinesia, rigidity, and postural instability. However, it's crucial to remember that symptoms often begin subtly, sometimes years before a formal diagnosis, and can affect one side of the body more than the other in the early stages. Recognizing this diversity is vital for accurate and timely intervention, as early signs can be easily dismissed or attributed to normal aging. Tremor is perhaps the most iconic symptom of Parkinson's, often presenting as a pill-rolling tremor of the hand or fingers, especially at rest. It typically starts on one side of the body and can spread over time. While highly characteristic, not all people with Parkinson's experience significant tremor, and not all tremors are indicative of Parkinson's. It's crucial for a neurologist to differentiate between different types of tremors. This resting tremor usually subsides during voluntary movement and sleep, which helps distinguish it from other conditions. It's often the first symptom that family members or individuals themselves notice, causing initial concern and prompting medical evaluation. The rhythmic oscillation can range from barely perceptible to profoundly disruptive, impacting daily activities and causing significant distress. Bradykinesia, or slowness of movement, is another cardinal motor symptom and is often considered the most disabling. It manifests as difficulty initiating movement, decreased amplitude and speed of repetitive movements, and a general reduction in spontaneous movement. This can make everyday tasks incredibly time-consuming and frustrating. Imagine struggling to button a shirt, tie shoelaces, or even just turn over in bed. Patients may experience freezing of gait, where they suddenly feel stuck to the ground, unable to move their feet forward, often in doorways or when turning. Bradykinesia also contributes to micrographic, small, handwriting and a reduced facial expression, often referred to as facial masking, where the face appears emotionless or blank. It's a pervasive symptom impacting virtually every aspect of daily motor function. Rigidity refers to stiffness of the limbs and trunk, often described as a lead pipe or cogwheel rigidity, where resistance to movement feels jerky, like turning a cogwheel. This stiffness can be painful and limit range of motion, contributing to stooped posture and a shuffling gait. It's caused by sustained muscle contractions, which can lead to chronic aches and muscle fatigue. Unlike spasticity, which is velocity-dependent, Parkinsonian rigidity is constant throughout the range of motion. This persistent muscle tension not only makes movement difficult but also increases energy expenditure, contributing to the profound fatigue experienced by many individuals with the disease. The rigidity can be particularly pronounced in the neck, shoulders, and lower back, significantly impacting posture and comfort. Postural instability, characterized by impaired balance and coordination, typically emerges in the later stages of Parkinson's. It increases the risk of falls, which can lead to serious injuries. Patients may have a stooped posture with a forward lean, making them more prone to losing balance. The body's automatic reflexes that help maintain balance become impaired, making it difficult to correct oneself after a stumble. This symptom significantly impacts independence and can necessitate the use of walking aids. Fear of falling can also lead to reduced mobility and social isolation, further deteriorating quality of life. Rehabilitation, particularly physical therapy focused on balance training, becomes crucial in managing this challenging aspect of the disease. Beyond the classic motor symptoms, Parkinson's disease is accompanied by a wide array of non-motor symptoms, which can often appear years before motor signs and can be even more debilitating. These include sleep disturbances, depression, anxiety, constipation, loss of smell, anosmia, and cognitive changes. These symptoms are often overlooked or misattributed to other conditions, delaying diagnosis and appropriate management. For example, severe constipation can be an early indicator, appearing decades before motor symptoms. Understanding the full spectrum of non-motor symptoms is vital for a holistic approach to care, as they significantly impact daily life and overall well-being. Addressing these non-motor aspects can profoundly improve a patient's quality of life. Sleep disturbances are incredibly common in Parkinson's, affecting up to 90% of patients. These can include insomnia, restless leg syndrome, and vivid dreams or acting out dreams, known as REM sleep behavior disorder, RBD. RBD is particularly significant because it can precede the onset of motor symptoms by many years and is considered a strong predictor of Parkinson's or related synucleinopathies. Patients with RBD may physically act out their dreams, sometimes causing injury to themselves or their bed partner. Poor sleep quality exacerbates fatigue, cognitive difficulties, and mood disturbances, creating a vicious cycle. Addressing sleep issues is a critical component of managing the overall burden of the disease. Mood disorders, particularly depression and anxiety, are prevalent in Parkinson's and are often present from the earliest stages. Depression can affect up to 50% of patients, while anxiety is also very common. These aren't just psychological reactions to the disease, they are believed to be direct consequences of the neurochemical changes occurring in the brain, including alterations in serotonin and norepinephrine systems, in addition to dopamine. These mood disturbances can significantly impair quality of life, making it difficult to cope with other symptoms and engage in activities. Early recognition and treatment of depression and anxiety are crucial, often requiring a combination of medication, psychotherapy, and lifestyle interventions. Neglecting these aspects can severely impact a person's ability to manage their condition. Cognitive changes, ranging from mild forgetfulness to more severe dementia, can also occur in Parkinson's. While not everyone develops significant cognitive impairment, a substantial proportion will experience some degree of executive dysfunction, affecting planning, problem-solving, and multitasking. Memory problems, difficulty with spatial reasoning, and slowed thinking are also common. Parkinson's disease dementia, PDD, is a distinct condition that typically emerges in the later stages of the disease, affecting around 30 to 40% of long-term patients. These cognitive challenges can significantly impact independence and require careful management, often involving cognitive rehabilitation and specific medications. Understanding these changes helps families provide appropriate support and adapt to evolving needs. Loss of smell, or anosmia, is one of the earliest and most overlooked non-motor symptoms. It can precede motor symptoms by many years, sometimes even a decade or more. Patients often report difficulty smelling foods, flowers, or even dangerous odors like gas leaks. This symptom is so common that it's being investigated as a potential early biomarker for the disease. While seemingly minor, anosmia can impact appetite, food enjoyment, and safety. Its presence, especially when combined with other subtle non-motor symptoms like constipation or REM sleep behavior disorder, can raise a red flag for clinicians and prompt closer monitoring for the development of Parkinson's. This early indicator highlights the widespread impact of the disease beyond just motor control. Diagnosing Parkinson's disease is primarily a clinical process, based on a careful neurological examination and a detailed review of medical history. There is no definitive blood test or imaging scan that can unequivocally confirm Parkinson's, although research is ongoing in this area. Neurologists look for the presence of at least 2 of the 4 cardinal motor symptoms: tremor, bradykinesia, rigidity, and postural instability, particularly when they are asymmetric, affecting one side more than the other, and respond well to L-DOPA medication. The diagnostic process can be challenging, especially in the early stages when symptoms are subtle and mimic other conditions. It often requires ruling out other neurological disorders through various tests. While no single definitive test exists, several tools aid in the diagnostic process. MRI scans are often used to rule out other conditions that can cause similar symptoms, such as stroke or brain tumors, which might mimic Parkinsonian features. A DAT scan, dopamine transporter scan, can help distinguish Parkinson's from essential tremor or drug-induced Parkinsonism by visualizing dopamine transporters in the brain. However, it cannot differentiate Parkinson's from other neurodegenerative disorders that also involve dopamine deficiency. Ultimately, the diagnosis relies heavily on the expertise of an experienced neurologist, who observes the progression of symptoms and the patient's response to medication over time. This clinical acumen is paramount. The management of Parkinson's disease is a lifelong journey aimed at alleviating symptoms, improving quality of life, and slowing disease progression where possible. There is currently no cure, but treatments have advanced significantly, offering substantial relief and enabling many individuals to lead fulfilling lives for many years. A holistic approach is essential, involving a team of healthcare professionals including neurologists, physical therapists, occupational therapists, speech therapists, dietitians, and mental health specialists. Treatment plans are highly individualized, tailored to the specific symptoms, disease stage, and overall health of each patient. This comprehensive, multidisciplinary care is the cornerstone of effective management. Medication is the cornerstone of Parkinson's management, primarily focused on replenishing dopamine levels or mimicking its effects in the brain. Levodopa, often combined with carbidopa, Sinemet, is the most effective drug for controlling motor symptoms. It's a precursor to dopamine and is converted into dopamine in the brain. While highly effective, its long-term use can lead to motor fluctuations and dyskinesias, involuntary movements. Other medications include dopamine agonists, MAOB inhibitors, COMT inhibitors, and amantadine, each working through different mechanisms to improve symptoms. The choice and dosage of medication are carefully titrated by a neurologist based on the patient's individual response and side effects, requiring ongoing monitoring and adjustments. Levodopa, often considered the gold standard for Parkinson's treatment, dramatically improves bradykinesia and rigidity. However, after several years of use, many patients experience motor fluctuations, where the medication's effects wear off before the next dose, leading to periods of increased symptoms, off periods, and dyskinesias, involuntary, writhing movements, during on periods. These fluctuations can be challenging to manage, requiring careful adjustment of dosing schedules, the addition of adjunct therapies, or exploring advanced treatment options. Despite these complexities, levodopa remains an indispensable medication, offering profound relief and enabling many patients to maintain mobility and independence for extended periods. Dopamine agonists, such as pramipexole and ropinirole, mimic the effects of dopamine in the brain by binding to dopamine receptors. They are often used as initial therapy, especially in younger patients, to delay the need for levodopa, or as an adjunct to levodopa to reduce off times. While effective, they can have side effects like hallucinations, compulsive behaviors, and drowsiness. MAOB inhibitors, like razagiline and selegiline, prevent the breakdown of dopamine in the brain, thus increasing its availability. They can be used as monotherapy in early Parkinson's or as an add-on to levodopa to extend its effects. Each class of medication comes with its own profile of benefits and risks, and the optimal regimen is highly personalized. For patients whose motor symptoms are no longer adequately controlled by medication or who experience severe dyskinesias, deep brain stimulation, DBS, surgery can be a highly effective option. DBS involves surgically implanting electrodes into specific brain regions, most commonly the subthalamic nucleus or globus pallidus. These electrodes are connected to a device similar to a pacemaker, which delivers precisely controlled electrical impulses to regulate abnormal brain activity. DBS does not cure Parkinson's, but it can significantly reduce tremor, rigidity, bradykinesia, and dyskinesias, allowing for a reduction in medication and a substantial improvement in quality of life. It is typically considered for individuals who have had Parkinson's for at least 4 to 5 years, have prominent motor fluctuations, and respond well to levodopa. The DBS procedure is a complex neurosurgical intervention. During the surgery, electrodes are carefully positioned in the target area, often with the patient awake to allow for real-time feedback on symptom improvement. After implantation, the device is programmed externally, with settings adjusted over weeks or months to optimize symptom control and minimize side effects. While generally safe, DBS carries risks inherent to any brain surgery, such as infection or hemorrhage. Post-surgery, patients require ongoing follow-up to fine-tune stimulation settings and manage medications. For carefully selected candidates, DBS can be transformative, restoring significant motor control and enhancing independence. Beyond medication and surgery, supportive therapies are indispensable in managing Parkinson's disease. Physical therapy plays a crucial role in improving balance, gait, flexibility, and overall mobility. Therapists help patients develop strategies to overcome freezing episodes, improve posture, and maintain physical fitness. Occupational therapy focuses on adapting daily tasks and environments to preserve independence, teaching techniques for dressing, eating, and hygiene. They might recommend adaptive equipment to make activities easier. Speech therapy addresses speech difficulties, dysarthria, and swallowing problems, dysphagia, which are common in Parkinson's, helping patients maintain clear communication and safe eating. These therapies are not just about symptom management, they empower patients to maintain their dignity and engagement in life. Exercise is not just beneficial, it is a critical component of Parkinson's management and has been shown to slow disease progression in some studies. Regular physical activity, including aerobic exercise, strength training, and balance exercises, can improve motor symptoms, reduce rigidity, and enhance overall well-being. Activities like walking, swimming, cycling, dancing, especially tango, which focuses on balance and coordination, and Tai Chi are particularly recommended. Exercise also helps combat fatigue, improves mood, and can enhance cognitive function. It's a powerful non-pharmacological intervention that empowers individuals to take an active role in managing their health. Encouraging a consistent exercise routine, tailored to individual abilities, is a cornerstone of comprehensive care. Nutrition also plays an important, though often overlooked, role. A balanced diet rich in fruits, vegetables, whole grains, and lean proteins can help manage common non-motor symptoms like constipation and fatigue. Staying well hydrated is crucial. For patients on levodopa, protein intake needs to be carefully managed, as large amounts of protein can interfere with the absorption of the medication. Some patients benefit from spreading their protein intake throughout the day or reserving most protein for evening meals. Consulting with a dietitian experienced in Parkinson's care can help tailor a nutritional plan that supports overall health and optimizes medication effectiveness, ensuring patients receive adequate nutrients while minimizing drug interactions. The journey with Parkinson's disease can be emotionally taxing, not just for the patient but also for family members and caregivers. Support groups offer a vital lifeline, providing a safe space for sharing experiences, gaining practical advice, and reducing feelings of isolation. Connecting with others who understand the unique challenges of Parkinson's can be immensely therapeutic. Caregivers, in particular, often face significant emotional and physical strain, and dedicated support resources for them are equally critical. Counseling, respite care, and educational programs empower caregivers to sustain their invaluable role while also safeguarding their own well-being. A strong support network is essential for navigating the long-term complexities of the disease. Research into Parkinson's disease is advancing at an unprecedented pace, fueled by a deeper understanding of its genetic and molecular underpinnings. Scientists are exploring novel drug targets aimed at preventing alpha-synuclein aggregation, protecting dopamine neurons, or even regenerating lost cells. Gene therapy and stem cell therapy hold immense promise, with several clinical trials underway investigating their potential to halt or reverse the disease process. Biomarker discovery is another crucial area, striving to identify reliable indicators for early diagnosis and tracking disease progression, which would revolutionize treatment paradigms. These cutting-edge investigations offer a beacon of hope for a future where Parkinson's is not just managed, but cured. One exciting area of research focuses on repurposing existing drugs, which can significantly accelerate the development timeline. For instance, drugs initially developed for other conditions are being investigated for their potential neuroprotective effects or their ability to modulate alpha-synuclein pathology. Another promising avenue involves personalized medicine, where treatments are tailored based on an individual's specific genetic profile or disease subtype. This approach recognizes the snowflake nature of Parkinson's, aiming to deliver the right treatment to the right patient at the right time. The goal is to move beyond symptomatic relief towards disease-modifying therapies that can truly alter the course of Parkinson's. The role of the gut microbiome in Parkinson's disease is also gaining significant attention. Emerging research suggests a strong gut-brain axis connection, where alterations in gut bacteria might influence brain health and contribute to Parkinson's pathology. For example, specific bacterial profiles have been linked to increased inflammation and alpha-synuclein aggregation. This opens up intriguing possibilities for therapeutic interventions targeting the gut, such as probiotics, prebiotics, or fecal microbiota transplantation, to potentially impact disease progression. This holistic view of the body's systems underscores the complexity of Parkinson's and the innovative approaches being explored to combat it. Early diagnosis is paramount in Parkinson's disease, even though a definitive cure remains elusive. Identifying the disease in its nascent stages allows for earlier intervention with medications and lifestyle adjustments, which can significantly improve symptom management and potentially slow the progression of certain aspects of the disease. Early diagnosis also provides patients and families with valuable time to educate themselves, plan for the future, and access supportive therapies like physical and occupational therapy, which are most effective when started early. It empowers individuals to take proactive steps in managing their health, potentially preserving quality of life for a longer duration. While challenging, the benefits of early detection are substantial. Living with Parkinson's requires resilience and adaptability. Small adjustments in daily routines, such as using assistive devices, modifying home environments to prevent falls, and establishing consistent medication schedules, can make a significant difference. Maintaining social connections, pursuing hobbies, and staying engaged in meaningful activities are vital for mental and emotional well-being. Advocacy and patient education groups play a crucial role in empowering individuals to navigate the healthcare system and connect with resources. Embracing a proactive approach, rather than succumbing to the disease, is a key strategy for maintaining independence and a good quality of life despite the challenges. The psychological impact of Parkinson's cannot be overstated. Dealing with a progressive, chronic illness that affects movement, communication, and cognition can lead to feelings of frustration, grief, and loss of identity. It's essential to address these emotional challenges openly. Mental health support, including therapy, support groups, and mindfulness practices, can help individuals cope with the emotional burden. Encouraging open communication between patients, families, and healthcare providers is crucial for identifying and managing psychological distress effectively. A holistic approach to care recognizes that the mind is as important as the body in battling a complex disease like Parkinson's. The future of Parkinson's treatment is brighter than ever, with a robust pipeline of new therapies. From novel drug formulations that offer more stable dopamine delivery to immunotherapies targeting alpha-synuclein, the landscape of potential treatments is rapidly expanding. Advances in genetics are paving the way for gene editing techniques and personalized medicine. Furthermore, improvements in deep brain stimulation technology, including adaptive DBS systems that respond to brain activity in real time, promise even greater precision and efficacy. These innovations, driven by relentless scientific inquiry and patient advocacy, hold the promise of not just better symptom management, but truly disease-modifying and even curative interventions. In conclusion, Parkinson's disease is a multifaceted neurological disorder characterized by the loss of dopamine-producing neurons, leading to a complex array of motor and non-motor symptoms. While its exact causes remain a mystery, a combination of genetic and environmental factors is believed to play a role. Management involves a personalized approach, integrating medication, supportive therapies, exercise, and nutritional guidance. Deep brain stimulation offers a surgical option for selected patients. Crucially, ongoing research offers tremendous hope for disease-modifying treatments and a potential cure in the future. Understanding Parkinson's is the first step towards better diagnosis, more effective treatment, and ultimately, a better quality of life for millions worldwide. If you or a loved one are experiencing symptoms consistent with Parkinson's disease, it is imperative to seek the advice of a neurologist for accurate diagnosis and personalized treatment. Early intervention can make a significant difference in managing symptoms and improving long-term outcomes. Furthermore, consider joining local support groups or engaging with reputable Parkinson's foundations, which offer invaluable resources, educational materials, and a sense of community. Your proactive engagement in understanding and managing this condition is the most powerful tool in navigating its challenges. Stay informed, stay active, and never lose hope in the ongoing fight against Parkinson's. Thank you for watching and learning with us.